Common injuries and preventing strategies. Rotator cuff tendonitis. Causes: overuse and repetitive motion. Symptoms: pain in the front and or side of the shoulder, often radiating down the arm. Prevention techniques. Dryland strength training. Proper warm-up techniques. Active stretches, resistance band exercises, and exercise focusing on shoulder mobility and stability. Correct stretching routines. Focusing on external rotation, lat stretches, and pec stretches. Swimmer's knee. Causes: repetitive strain and stress on the medial collateral ligament, MCL, during the breaststroke kick. Symptoms: pain, tenderness, swelling, clicking or popping, stiffness, weakness. Prevention techniques. Proper swimming technique, strength training, and a well-rounded workout routine. Proper warm-up exercises. A cardiovascular warm-up, targeted muscular activation, and dynamic mobility exercise before and inside the pool. Correct stretching routines. Strengthening muscles around the knee, improving hip flexibility, and incorporating dynamic warm-up exercises. Achilles tendonitis. Causes: overuse and repetitive stress. Symptoms: pain, stiffness, swelling, and warmth in the back of the heel and along the tendon. Prevention techniques: gradually increasing activity levels, proper footwear, regular stretching, and strengthening calf muscles. Proper warm-up techniques: dynamic stretching like walking on your toes, heel raises, and incorporating eccentric calf strengthening exercises. Correct stretching routines. Exercises that prepare the calf muscles and Achilles tendon for activity.
Can I help you?
Yes.
Expose your injury. What happened?
Um, I was swimming and then I did a flip turn and I slammed my ankle into the wall.
Okay. How did it happen?
I hit the wall.
Where does it hurt? Point to it with one finger. What type of pain is it? Dull, aching, sharp, shooting, or tingling?
Sharp and tingling.
Any radiating pain?
Yes.
Has it ever happened before? If so, how long ago?
Yesterday.
Did it just happen?
Yeah, it happened today too.
Okay. Has it been going on for a while?
Kind of.
Level of pain, 1 to 10.
10.
What type of training have you been doing?
Swimming.
Does it feel loose?
No.
Any medications?
No.
Any restrictions or limitations?
I can't fully straighten it.
Did you feel anything pop or snap?
I think the back of my ankle snapped.
Did you feel anything locking, catching, or giving out?
My ankle gives out.
Okay. Please note in detail what the athlete remembers happening.
I remember I was going to the wall. I got too close. I slammed my leg straight into the corner where the edge of the wall is.
Okay. Observation.
It's right outside the city.
It's a little black, yellow, with some toes. Have athletes sit on table and draw out ABCs with injured ankle.
Okay.
Have athletes stand on single leg with the injured ankle. Have athlete balance for 20 seconds on injured ankle. One time with eyes closed. Second time with eyes closed. Have athlete do a double foot toe raise. Have athlete take a few steps forward on tiptoes. Please sign here.
For finger buddy taping, you want to cut the tape in half and roll around the patient's fingers on the upper part and the lower part. First, you want to start with pre-wrap and wrap the wrist and the hand twice. Then start wrapping the wrist with tape twice. When wrapping the palm, make sure to fold a little bit of the tape near the thumb and continue wrapping around the wrist and make sure to clean up of any imperfections. When you're doing ankle taping, make sure that your athlete is in constant dorsiflexion and start pre-wrapping their entire foot. When you are done pre-wrapping their foot, make sure to put 2 anchors on top of their heel, one at the calf and one on their ankle. You want to do 2 stirrups, a medial stirrup and then a lateral stirrup. When you're doing your first horseshoe, make sure to always anchor the top. Make sure to always cover the malleoli. When you're done with the stirrups, you're going to start with the heel locks. You'll go to the start of the malleoli, and then you're going to wrap all the way under the foot and under the ankle, and you'll end at the top of the foot again. And when you're done with your heel locks, make sure to clean up any mistakes or any windows. Working on my volunteer patients helped me learn how to assess injuries using the HOPS protocol and apply taping techniques that will help me in the future whenever somebody in need would need treatment. This experience will help me create better treatment plans in the future by focusing on both healing and preventing injuries.